So with regards to treatment implications, I'm going to say a few words on treatment implications, and then I'm going to just go over a case of a patient that we had here recently. So medical stabilization and safety assessment, first and foremost, always. Nutrition therapy really needs to be individualized and contingent on a sophisticated diagnosis, not just a DSM-5 lump diagnosis that is an umbrella over many different types of disease. So we want to make sure that nutrition therapy, whether it's all food fits or whether it's a low refined sugar or low white flour meal plan, focuses on flexibility, focuses on sustainability, and eventually focuses on intuitive eating. So eventually what becomes intuitive for a person with food addiction is to stay away from food substance that always leads them to trouble. That is intuitively healthy. Just like if somebody has a peanut allergy, they intuitively know after ingesting anything with peanuts to stay away from that because it makes them sick. We do a lot of education around health and health at every size, in combating thin bias and celebrating weight diversity and looking at other measures than weight and BMI for health. Like, are you getting regular pleasurable exercise? Are you eating a variety of foods? Is your blood pressure good? Is your cholesterol good? Much, much better indicators of health than BMI. We do a lot of family support, family meal support, and family therapy, devise a pleasurable movement plan, and then focus on skills building. A lot of times the skills building can be, ACT focused, it can be dialectical behavior therapy focused, it can be cognitive behavioral therapy focused. And then incorporating expressive therapies and body-centered therapies. I think it's so important to include the body, particularly when we're talking about eating disorders co-occurring with addiction, and also particularly when there are huge, huge, huge percentages of our patients who have endured physical abuse or sexual abuse or neglect. When we do trauma work, we want to make sure that the patient is, out of the grips of active addiction before we expose them to getting into detailed trauma work. And when we do it, we want to be always doing it with compassion, structure, consistency, and nurturance. And then we also want to connect people with community support. Because connection is going to hold them outside of treatment hours, which are a relatively small amount of their day.